So we're going to be talking about shock optic neuropathy. And shock can occur in a number of settings: cardiac arrest, sepsis, arrhythmia, asystole. There's all these ways you could get shock. So it's a final common pathway to damage the optic nerve if your blood pressure drops from any of these shock mechanisms. Normally, if your blood pressure drops, there are autoregulatory mechanisms that allow you to compensate across a very wide range of blood pressures. And so that autoregulatory curve is S-shaped like this. And so across a wide range of pressures, your body can make vasoconstriction, vasodilation, and can auto-regulate blood flow. But if the pressure goes too high or if the pressure goes too low, then you'll suddenly have a steep part of the curve and your blood pressure cannot be autoregulated anymore, and that thing we call shock. And because the perfusion pressure of the optic nerve equals the mean arterial pressure minus the intraocular pressure, in shock, we're not really talking about IOP. We're talking about MAP, 2/3 diastolic, 1/3 systolic. So any significant, severe, and acute drop in MAP will drop the PP, the perfusion pressure, and will lead to shock optic neuropathy. And for shock optic neuropathy, it often produces cupping and pallor. And the reason is cupping is a mechanical thing that we see. There's loss and deformation of the lamina cribosa. And so in glaucoma, cupping is from just the IOP is deforming the lamina cribosa. However, in shock, you're damaging the blood supply not just to the small vessels of the nerve head, but the posterior and the peel circulation to the disc as well, and that causes a collapse of the support tissue behind the lamina cribosa. So we see this post-ischemic optic neuropathy cupping. So we have cupping after ischemic optic neuropathy. There are two settings we see it in. One is giant cell arteritis. So in the non-arteritic form of AION, you just get a sector or diffusely pale nerve. It doesn't cup. But in giant cell, it starts with pallid edema and ischemic infarction that kills not just the nerve, the axon, but the support structure. And then the whole thing just collapses. So if we see cupping before or after AION, that's the marker that it might be giant cell arteritis. And for shock, it's not an arteritic mechanism. It is just a perfusion pressure. And if you damage the material of the lamina cribosa, even under normal IOP, it'll collapse. And that thing we call shock optic neuropathy. You need to know about it because it can look like glaucoma. But it's non-glaucomatous cupping. It'll have rim pallor and loss of acuity, and they'll tell you I had shock, so it's really the history. And we would not want to mistake glaucomatous cupping for post-shock optic neuropathy, non-glaucomatous cupping, or arteritic anterior ischemic optic neuropathy.